I'm Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Few issues have tested public trust in medicine as profoundly as vaccines. And few voices have shaped that conversation more than Dr. Paul Offit, a pediatrician, scientist, and author who directs the Vaccine Education Center at the Children's Hospital of Philadelphia and serves as a professor of vaccinology at the University of Pennsylvania's School of Medicine. Dr. Offit is also the co-inventor of Rototech, the rotavirus vaccine now recommended globally, and has published more than 170 scientific papers, along with a dozen books examining vaccine history, safety, misinformation, and medical innovation. Until September 2025, he served for many years on the FDA's Vaccine Advisory Committee. Over the course of his career, he has received numerous prestigious awards and is a member of the American Academy of Arts and Sciences. Today, we'll talk with him about the state of vaccine science, the lessons learned from the pandemic, and how to address misinformation. We'll also talk about the growing challenges to public trust in science. Thanks so much for joining us today.
My pleasure.
So I'd like to get started with learning more about you and first, what got you interested in medicine?
I think the real answer to that question is when I was 5 years old, I had been born with club feet and my right foot didn't heal properly. So they performed an operation on my foot they probably never should have done because it wasn't perfected for another 40 years. But that landed me in a chronic orthopedic facility called Cernans Hospital for Crippled Children. And when you're in the mid-1950s, if you're in a orthopedic facility, you were in a polio ward. So I was there for 6 weeks. There was sort of one visiting hour a week. My parents actually were unable to come for a variety of reasons. So I was there by myself for about 6 weeks. And I remember children in iron lungs, and I remember the so-called Sister Kenny hot pack treatments where children would be given these excruciatingly hot packs on withered arms and legs to try and restore function. And I remember them screaming, and there was, the nurses were not all that nice, and it was like a Dickens-like experience. And I think to be honest with you, I think it scarred me. And I think the scars of our childhood invariably become the passions of our adulthood. And I think I sort of see myself in the hospital bed in many ways. And I guess that's my motivation and passion for children, I think, is that I saw them as vulnerable and helpless and alone as I saw myself at that time. I think it was a scarring experience. And I think I really do think the things that happen to you when you're 4 or 5 tend to really define things for you. That's what happened to me.
Thank you for sharing that. So exposed to the medical world at a very early age. And kind of want to build on that. We're speaking to you in the midst of an unusually tough flu season, a resurgence of measles, and a downward trend in vaccination rates. What do you make of this situation, and how do you think we can turn these trends around?
It's pretty grim. I mean, as you noted, last year, 2025, we had more measles cases than we'd had in 33 years. We had 3 people die from measles. That's the most measles deaths combined over the previous 25 years. We've had 2 little girls, 6 and 8-year-old girls, die in West Texas of measles. That's the first child death in this country since 2003. We've had more tetanus cases last year than we've had in 10 years. We've had states experience whooping cough deaths in babies that hadn't experienced whooping cough deaths in years. And you're right. We had about 289 children die of flu last year and dozens already this year. So it's bad. And it's because of an erosion in vaccine rates. It's because of a distrust in vaccines. And, you'd like to think you can educate about the importance of the vaccine and how deadly these diseases can be. But I fear that what's going to be doing the educating is the viruses at this point, and it's a hard way to do it.
That's a really important point and kind of touches on how we rebuild that trust. And I think part of that perspective is helping people understand the full picture. How do you explain to the public why vaccines can be both life-saving and imperfect at the same time? And what communication strategies actually work?
Right. So vaccines are designed to prevent diseases, and they are safe in the sense that their benefits outweigh the risks. But like any biological medicine or otherwise, there's always at some level going to be risks. I mean, I think the COVID, provides 2 interesting examples. On the one hand, you had this virus, SARS-CoV-2, that came into this country and started killing people in early 2020, around February 2020. And then we used to combat a virus that had unusual biological characteristics, unusual clinical characteristics, and using a technology we had never used to make vaccines before, messenger RNA. We, in 11 months from isolating that virus and sequencing its genome, we had done 2 large prospective placebo-controlled clinical trials, 40,000 for Pfizer, 30,000 for Moderna, to show that the vaccine worked and was safe, at least defined as not having an uncommon serious side effect. But as the vaccine rolled out and millions and tens of millions and hundreds of people were vaccinated, you found that the vaccine was a rare cause of myocarditis, inflammation of the heart muscle, primarily in 16 to 29-year-old boys and men. Generally, it's transient, self-resolving, short-lived. So that was not really a price to pay. And in the scheme of things, where you can have a serious adverse event, which is what happened with the next vaccine, right? February 2021, we authorized the Johnson & Johnson COVID vaccine, which was a different strategy. It was the adenovirus vector strategy. And that 40,000 people were tested, pre-authorization, which tells you that you didn't have an uncommon serious side effect. But then when it was given to almost 20 million people in this country, it was found to be a rare cause of clotting, including severe clotting, including clotting in the brain, including fatal clotting of the brain. It was rare, like 1 per 250,000, but it was real. And ultimately that drove that vaccine off the market by May of 2023, 2 years later, because one, we had a safer vaccine, and that became an unacceptable side effect. You learn as you go, and I think that's something people can never quite internalize. I mean, if you look at any medical advance, whether it's anesthesia or antibiotics or gene therapy, there is always a human price to pay for knowledge, and that's, for most people, unacceptable.
That's a really great reflection. Thank you for laying it out so clearly for us right there. So going back to that communication piece, many families still struggle to evaluate claims circulating on social media about safety, ingredients, long-term effects. What practical advice would you offer to parents trying to sort out the credible information versus misinformation?
I think it's really hard. I think when you go on the internet and try and figure out whether something is a cause of something else, at some level, it does require, so let's say whether or not a vaccine causes a problem. At some level, it requires some basic knowledge of virology, immunology, the statistics, epidemiology, et cetera. Most people don't have that expertise. So what they do is they read other people's opinions on the internet, which is really not doing your research. I think in the end, the best advice is to find somebody you trust and trust them. Somebody who at least has some working expertise in the field and trust them is the best way to do it. But that's not what we do. We go on the internet and just, look at whoever we can find and whoever's voice is the loudest. And sometimes sometimes there are people who have an expertise. I mean, I'll give you an example. Robert Malone was really many ways a brilliant scientist. In the late 1980s, he published an important paper in the Proceedings of the National Academy of Sciences that really laid the groundwork for mRNA as a technology, as a vaccine technology. He didn't win the Nobel Prize, but he could have. And then there he is years later testifying in front of Congress that the COVID vaccine caused cancer and that the vaccine contained microchips so that, so that the CIA could detect who'd been vaccinated, who hadn't. He was a brilliant man, an MD, brilliant scientist. So who do you trust? I mean, it's really hard. How do you know who to trust when even experts are giving you dangerous advice?
Yeah, exactly. That's really helpful. And as a parent, I know sorting through so much noise is definitely tricky. So you have also seen the full journey of a vaccine firsthand as the co-inventor of the rotavirus vaccine. What did that experience teach you about what helps modern vaccine innovation succeed and what can get in the way?
It's a long process. That's what I learned. Also, just for the record, I worked on rotavirus for about 26 years. When you're doing that, you don't think you're making a vaccine. You're just trying to understand the virus because you want to be able to publish your papers, which enables you to get your grants, which enables you to get your next grant and your next grant, and hopefully ultimately get your children through college. I mean, that's where your focus is not, you're not thinking I'm making a vaccine, even though that's the first paragraph of your grant, because that would be too difficult to think that's what you're doing. You'd be frustrated if that's That's what we thought. But fortunately, I was with the two brilliant people, Stan Plotkin and Fred Clark, who together among the three of us, we were able to create the strains that became the bovine human reassortant vaccine Rototec. What I learned in that is it's a massive effort. I mean, First, you have to define whether the disease is worth preventing. Two is you have to find preferably an animal model, so you can do the kind of proof of concept studies that show that at least what you're doing could be a vaccine. Then you do, you do phase 1 studies. Hopefully you can find a pharmaceutical company that's interested because they're the only ones who can do, good manufacturing practices and the roughly $1 billion to $1.5 billion it takes to make a vaccine. Then you do phase 1 studies to see, in dozens of people to see whether the vaccine induces an immune response, looks like it could be protective and doesn't have a very common side effect problem. Then you do phase 2 studies, which are hundreds of people to show that it doesn't have just an uncommon side effect. Then you do phase 3 studies of tens of thousands of people to show that it doesn't have a very uncommon side effect. And then, then it's out in the world where there's things like the Vaccine Adverse Events Reporting System or the Vaccine Safety Data Link, which will pick up a rare adverse event, as was seen with the J&J vaccine. That was a 26-year effort. That probably cost Merck, who ultimately made the vaccine, about $1.5 billion. You have to have the right buffering agent, the right stabilizing agent. You have to do real-time stability studies. You have to find the right vial. And probably only one of 7 putative vaccines actually ever becomes a vaccine. So it's really hard. Then you work your way through the FDA, and then hopefully, the CDC recommends your vaccine. But it's what I learned in all that is it's really hard. There's so many go, no-go decisions, where because vaccines, I think people don't realize this, are, they're not a big moneymaker. They're something you give once or a few times in your lifetime, and they're never going to compete with like lipid-lowering agents or other much bigger products. So these companies, it's always sort of the weak sister of these companies. Because in 1955, there were 27 companies that made vaccines. By 1980, there were 18. By the end of the decade, there were 4. And there used to be vaccine makers. I mean, companies that just made vaccines. That's not true anymore. This is always a small part of a much bigger pharmaceutical company, and they could leave it. I think these companies could leave vaccines in a minute. Make it hard enough Make it burdensome enough for them to make these vaccines, and they'll leave.
Wow. Hearing that from someone like you who has kind of lived that entire journey is fascinating. It really shows how many moving parts are behind the scenes with that 26-year effort. And you mentioned one of those moving parts involves policy. You served for years on the FDA's Vaccine Advisory Committee. What insights did that experience give you into how vaccine policy decisions are made?
That they're made well, at least they were, up until February of 2025, when Robert F. Kennedy Jr. was sworn in as Secretary of Health and Human Services. So I was on the committee, FDA Vaccine Advisory Committee, so-called VRBPAC committee, from 2017 to 2025. So that encompassed, the COVID vaccines. And so in December of 2020, when we were submitted the data for Pfizer's vaccine and then Moderna's vaccine, Pfizer's was December 10th, Moderna's was December 17th, you're given 200 pages by the company of all their data. And for say, the Pfizer vaccine. Then you're also given 200 pages of data from the FDA because they want to make sure that they look at every piece of information to make sure that the company didn't omit something or didn't misrepresent something. So you read basically 400 pages over that week before you meet, and you read every word of it, because you're responsible for recommending authorization or not, or licensure or not for these vaccines. And you know that what you're looking at, in, the case of the Pfizer study, it's a 40,000 person prospective placebo-controlled trial. So that's 20,000 adults got the vaccine, 20,000 didn't. You are now about to make a recommendation for tens of millions of people. So you're looking very carefully to see whether there's anything in there that suggests that there would be a problem. It's an awesome responsibility. And then, a week later, you're looking at reading another 400 pages for the, in that case, the Moderna vaccine, on a 30,000 person trial. So the people around that table had expertise in virology and vaccinology and immunology and statistics and epidemiology. So it's an expert advisory group. And you learn a lot from listening to other people, and we don't always agree. But I think anybody who watches that process would feel reassured that at least we're trying to give the best advice.
Absolutely. And thank you for sharing that so openly. It's a perspective I think most people don't get to hear. Looking ahead, What scientific frontiers are you most excited about in the next decade for infectious disease prevention?
Well, first of all, I think the mRNA technology may be able to extend beyond SARS-CoV-2 virus. I mean, certainly we can make better vaccines against malaria or tuberculosis. And so I think there's that. I think the mRNA platform also can be used for cancer, for autoimmune diseases. So I think that's true. I think in the infectious disease world, I think the adjuvants are an interesting new technology. I mean, we have, like novel adjuvants for one of the hepatitis B vaccines. Adjuvants really enable you to give lower doses of the vaccine, enable you to give lesser quantities of the actual vaccine itself. So adjuvants, I think, are another sort of frontier. But I just hope that the infrastructure will remain in place at NIH to allow all that to happen.
That's really exciting to hear. There's so much innovation happening, and your sense of where things are heading is really energizing. I want to shift gears a little bit and kind of come back to Osmosis. So at Osmosis, we are a teaching company. We always love to ask if there's a topic you think Osmosis should make a video about to fill a gap that is of particular importance to you.
I think if you could go through just what you have to do to make a vaccine, because I think what people saw, for example, with COVID, is they saw a virus come into this country and start killing people in February. And then 11 months later, we had a vaccine. And I think people thought, well, it was just that fast. But it's really not, because there were three heroes in this vaccine. I think the first was, as probably most people know, was Drew Weissman and Katie Carrico, who met in 1997 and started working on mRNA as a potential technology platform for vaccination. The second was, I think everybody recognized, was Operation Warp Speed, where the Trump administration gave $11 billion basically to allow on 6 horses to win one race. And so they took the risk out of it for pharmaceutical companies. I mean, the companies could do phase 1 trials, phase 2 trials, phase 3 trials, and then mass produce the vaccine. And even if they made millions of doses and the vaccine didn't work, then they would just throw those doses away without any cost to them. So by taking the risk out of it for pharmaceutical companies, that's what made it faster. The third thing that I think nobody recognized, the third hero of this pandemic, was NIH. Because when SARS-1 raised its head in Foshan, China, 2002, 2003, Barney Graham and his coworkers at NIH started working on a SARS-1 mRNA vaccine. Right. So they had a lot, or SARS-1 really never came into this country. And although it caused, thousands of deaths, thousands of cases and hundreds of deaths in the world, it didn't enter this country. So we never used a SARS-1 mRNA vaccine, but we learned a lot from doing that. And so I think when you look at a group like BARDA, the Biomedical Advanced Research Development Authority, and then you see Robert F. Kennedy Jr. take $500 million out of that program, especially for mRNA vaccines, especially for bird flu as an mRNA vaccine. It's when you have a research development authority, that's how it helps you. It helps you down the line. And when you take it away, you'll be less prepared the next time something raises its head. So bird flu, which may well become a pandemic. So I think if you could explain just how hard this all is and how much work goes into it, that would help.
That's a great idea. We're always looking for gaps we can fill. So I'm definitely taking that one back to the team. We might reach out to you for some help with that video down the road. So in our audience, we have many students and early career health professionals listening in. What's your advice to them about meeting the challenges of this moment and approaching their career in healthcare?
Okay, this will pass. I do think that we are in a turbulent and frankly unimaginable time. The good news, if there's any good news here, so when the CDC makes up its own vaccine schedule, which it did recently, and they didn't do it through the normal mechanism, which is through the ACIP, because we don't have an ACIP anymore. ACIP is Advisory Committee for Immunization Practices. We all used to look to the ACIP for information. We all used to look to the CDC for information, and we can't do that anymore. We can't. And so when they make up their own schedule, which is not a science-based schedule, the good news is groups like the American Academy of Pediatrics or Infectious Disease Society of America basically say, no, here's the schedule based on science. And the other good news is most pediatricians, for example, just look to the American Academy of Pediatrics. They're ignoring the ACIP. They're ignoring HHS. So that's good. It's too bad because information becomes more fragmented when you lose groups like the CDC and ACIP and HHS, but we've lost them. We will get past this. We will. And we will build things back up again. So hang in there. Don't worry about it. I think these things usually run in cycles, and Robert F. Kennedy Jr. and his ilk will cycle out. So in the meantime, just do good work, keep your head down, do good science, make science-based recommendations, because science wins out in the end. I mean, look at Galileo, right? He dared to believe Nicholas Copernicus's notion that the earth revolved around the sun. He was brought before a Roman Catholic tribunal because he didn't agree with the biblical notion that the earth is the center of the firmament, and he was made to recant. He recanted his treatise that bought into Nicholas Copernicus's notion that the earth revolves around the sun. But as he was being let out of that tribunal, he said, presumably in Italian, and yet it still moves. Meaning, you can put me in chains. That does not change the fact that the earth revolves around the sun. And no matter how many times Robert F. Kennedy Jr. says that vaccines cause one chronic disease or another, or no matter how many bad or discredited doctors or scientists he gets to agree with him, or how many congressmen he gets to agree with him, or how many media venues he gets to agree with him, he's still wrong. And science is a powerful thing to have on your side, and that's what we have on our side. So hang in there.
I like what you said there. Science wins out in the end. I want to ask you, what is next for you?
I'll do what I've been doing. I still teach, write. I have a Substack that comes out weekly, and I still interact with the media a lot. I mean, it's still like 3-4 media calls a day. So just trying to, keep the rudder in the boat and talk about science-based things, and with an understanding we'll get through this. So that's what teach and write.
Absolutely. Before we wrap up today's episode, is there anything we didn't cover that we maybe should have?
No, I think we covered the earth there. I don't want to depress people, though. I really want to say that I am a Philadelphia Eagles fan, so that they should take that in mind, because I'm an optimist.
Okay, noted.
I do think we'll get through this, and maybe in the end we'll be better for it, because we can see how much you can lose when you have this sort of situation.
Thank you so much, Dr. Offit, for being with us today. We really appreciate your time.
My pleasure. Thank you.
And that brings us to a close on today's episode. Dr. Offit, it's been a privilege to learn from you today. Your commitment to science, transparency, and patient care is felt far beyond the clinic or the classroom. And to our listeners, thank you for spending part of your day with us. I'm Lindsey Smith. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.